Dr. Marcus Plescia joins us now live on Skype from Atlanta, Georgia. He's the Chief Medical Officer at the Association of State and Territorial Health Officials, or ASTHO. Thank you for your time. So your NGO's website says you've been working with federal agencies and others to ensure that states have the resources and information that they need to effectively respond to this outbreak. Given the numbers that we're seeing now, do you think it's working, and where's the problem?
Well, it's very concerning what's going on now. And, I think that the part of the problem is that, people just aren't aware of this being an infectious disease, and that the minute we sort of let down our guard, the more we're likely to see upsurges in infection. I think what we're starting to see now in some of these states that are seeing the increases is a lot more attention to the tools that we have now to fight the infection. Contact tracing, really being aggressive in aggregate settings, congregate settings, and then really having the public take a lot more seriously some of the physical distancing rules, trying to keep 6 feet apart from other people and starting to wear masks more often.
Where is the problem, do you think? Is it a federal issue, a state issue, the politicization, rather, of the pandemic? This is turning into a political issue. Where is the problem here?
It's a state response. That's the public health system that we have in the United States. And so it's just set up that we're going to see differences in different places as different states adapt to their current situation. I think that, the response has not been a seamless response from the beginning. There's a lot of adversity and a lot of things to deal with. I do think we're getting there. I think states are starting to put into place the systems that will help us control this better, but we're a little behind, and we've unfortunately been behind from the very beginning.
President Donald Trump says we're seeing more cases because more testing is being done. Is that the case, or what other metrics should we be looking at here?
I think it's becoming increasingly clear that it's not just a result of doing more testing. We're seeing greater percentages of the tests going up as well. Unfortunately, we're also starting to see more people going and being hospitalized, and many of our hospitals really getting into a critical capacity. That's the thing that we're most concerned about here, is that if we're not careful and if we have too many cases, we can get to a point where our medical care system can become overwhelmed, and that would be very, very troubling and chaotic.
Why do you think that Americans are not taking the public health advice seriously, wearing masks? I mean, we did just talk about this new research out from Washington University predicting that nearly 180,000 people will have died from COVID-19 by October. But with that same research, more than 30,000 lives could be saved if, I believe it said, 95% of people wore masks. Why is it that people are not taking these sort of warnings seriously, do you think?
I don't know. We're really perplexed why more people aren't wearing masks. I mean, there have actually been some surveys of the general public about the response and the interventions that we put into place around COVID. And most of those interventions have actually been very well supported. 80 to 90% of people saying that they support what their government public health agencies have done. So I'm not sure what the disconnect is with masks. Maybe we just need to message it better. There was certainly some confusion early on about whether they helped or not. Now the data is pretty clear that they do. I think we just need to keep putting that message out there and really pushing more, even if it means more requirements to get more of the public to participate.
Thank you for that, Dr. Marcus Plescia there, Chief Medical Officer at the Association of State and Territorial Health Officials.